So, good evening, everyone. This is Suhasam from the batch of 2024. We present you the Infomania 4.0, which will be presented by the batch of 2025. So, in this session, we have Dr. Ashwini PR from the Department of Pathology. She will be the moderator for this session. And I'm happy to present you Kushal M. Magi from the batch of 2025, who will be presenting today's topic, which is Irritable Bowel Syndrome. So now I request Kushal to take over.
Good evening, everyone. Good evening, ma'am. Uh, just a second.
Kushal, you can start sharing your screen.
I hope it's visible to everyone.
Yes, it is visible. You can start.
Okay. Good evening, everyone. I'm Kushal Emagi from 2025 batch. I'll be discussing about irritable bowel syndrome today, which is also called IBS in short form. We'll basically discuss about discovery of IBS, a brief overview of IBS, then epidemiology, causes, pathogenesis, and clinical presentation. At the end, we'll discuss about treatment and prevention of IBS. If we have to start with discovery, it was originally called mucus colitis, which was discovered by Sir William Osler in 1892. It was not exactly called IBS back then, it was just mucus colitis. In 1944, the term irritable bowel syndrome was coined because this researchers got to know it is beyond just mucus colitis. It had a bigger mechanism behind it. The condition was also called spastic colon or nervous colon because it involves because it involves brain gut interaction, which was not known before. So the current name, irritable bowel syndrome, was introduced because the medical community began to better understand that the disorder has a combination of both physical and mental causes, and it is not just solely on the product of mental illness or just structural disease like true colitis. Early precursor of IBS was a combination of abdominal pain, mucus in stools, and psychological factors, which was basically described as psychiatrically in psychiatrically disordered young women, because it is mostly seen in young women. So when we talk about overview, as I told, is gut-brain interaction disorder. There is incomplete interaction between the gut motility and gut digestion and brain mechanisms. Though it is not life-threatening, it impacts quality of life, because we all know abdominal pain and cramps affect us a lot. Uh, how we concentrate, how we stay active in a day-to-day life. Factors affecting pathophysiology of IBS, we'll discuss in the future slides. And management of IBS is basically symptom relief. It is not complete cure for the disorder. It includes dietary changes, stress management, and medication. Functional gastrointestinal disorder, which means the digestive tract may look normal but doesn't exactly function normally how it functions in a normal person. It is not a disease that damages the digestive tract or increases the risk of cancer, which means it is not fatal. When we talk about epidemiology, it is spread across the world, like in a vast way. It is mostly seen in these parts of North America, like a small area in South Africa, and Pakistan area in Asia. It is also seen in Russia, not some areas of North America, USA, and some areas of South America also. It is quite less in areas like India, China, and some of the northeast countries. Uh, okay, the global prevalence of IBS is around 11%. It is mostly seen in women and younger adults. It is not seen in older adults. Like all of a sudden, it does not come. It has to start from a younger age, and it is basically the leading reason why people visit primary care centers. Even small abdominal pain or abdominal cramps gives a great deal of dissatisfaction to people, so they immediately visit primary care centers. Then recent data indicates that there is increasing rate of IBS in Asia Pacific region, as we saw in the previous slide. IBS is the seventh most common diagnosis in primary care settings. Then it is most common in individuals having pain related conditions like anxiety, depression, food related intolerances. We learn how these factors affect IBS in the future slides. One more point in this slide is it's a common disorder, and only a minimum number of only a fraction of patients occur go for medical care. Everyone does not go thinking it's a normal abdominal pain which comes and goes. uh, Studies also suggest that IBS aggregates in families, pointing a potential genetic component. We'll see how genetic component affects IBS in the next slides. So when we talk about causes of IBS, um, it does not have exact cause, but some contributing factors are food, stress and mental health issues, hormonal changes, severe gastrointestinal infections, disrupted gut-brain interaction, nerve hypersensitivity, and genetics, gut bacteria, and medications also are some causes for IBS. It is linked to dysfunctional gut-brain connection, making the brain and gut nerves hypersensitive, which we'll discuss better in the next slides. The gut-brain interaction, as we know, is a two-way communication. That is the enteric nervous system. In IBS, gut shows higher response to normal stimuli. Even a small stimuli gives greater pain. Oversensitivity of gut leads to pain, gas, changes in bowel habits. Childhood trauma shows higher risk of IBS. Food intake on IBS, how food intake affects IBS. So, not all the foods are compatible for all the gut environments. Some people cannot eat spicy food. Some people cannot eat high fiber rich food. So when you eat food which is not compatible for your gut environment, it triggers pain, gas, bloating, and changes in bowel habits. Then the common foods to avoid if you have IBS is fatty processed foods. Fatty processed foods are like fried items like French fries, burgers, chapati. and pastries, which is a processed food. Fats and processed food stimulate gut reflexes and the motility, causing pain and diarrhea. Then we have high FODMAP foods. FODMAP is basically fermentable oligosaccharides, this causes a great discomfort in your large intestine because these are basically short chain carbohydrates which are poorly absorbed in small intestine. So large intestine has to do a lot of work drawing in water to ferment, and this produces pain, gas, and bloating. Then we have caffeine. Caffeine can cause diarrhea and gut activity, which gives more work to intestine. Then again, it gives a lot of discomfort. Then we have dairy products. Dairy products, as we know, like cheese, milk, which might cause lactose intolerance in some people. So we can say that IBS is sometimes common in people with lactose intolerance. Yeah, we should also avoid gluten and spicy food because gluten is basically fiber, and higher fiber, as we saw, gives a lot of work to large intestine. So the large intestine has to do a lot of work by fermenting, using water, drawing in water, and this produces pain, gas, and bloating. Spicy food, some people can have it, like Americans can't have Mexican food, Indian food. This causes a great deal of discomfort in their gut. So yeah, next we'll talk about hormonal changes on IBS. Hormonal changes in IBS is basically like this flowchart. The corticotrophin releasing hormone is released in the brain. Cortisols are released. These cortisols, increase estrogen, progesterone, and serotonin. Uh, Basically, these three play a very important role in gut motility, absorption, and all. I'll explain the next flowchart. So in serotonin, it is basically a very important hormone because if serotonin increases, absorption in gut also increases. If serotonin decreases, absorption in gut decreases. So that's why we can say if serotonin increases, diarrhea occurs because there is more absorption in gut, and the food moves on faster in the gut. So this shows hypersecretion and hence IBS. If there is lesser serotonin levels, it shows constipation because there is no complete absorption of food, and the movement of food in the gut is slower. This is basically impaired motility, and this causes IBS. Then we have estrogen changes in IBS. Uh, okay, I can explain estrogen and progesterone together because low estrogen means lesser gut motility, and this can cause constipation. Reduced estrogen also increases mast cell activation, which increases visceral hypersensitivity and intestinal permeability. I'll explain what is visceral hypersensitivity in the next slide. When we talk about progesterone, it has inhibitory effect on smooth muscle contraction. This shows reduced the reduced levels of progesterone shows diarrhea. Hypersensitivity. Visceral hypersensitivity sensitivity is basically even for a smaller stimulus, you experience a great deal of pain. Like the darker line shows how pain intensity is for a normal person. They have to give this level of stimulus for the pain, to surge in a normal person. But then if a person suffering with IBS has a smaller stimulus, like much smaller stimulus than a normal person, he experiences a great deal of pain in his gut. This is called hyperalgesia, the greater deal of pain. And the decrease in pain threshold is like one of the most important characteristic of IBS, and this is called visceral hypersensitivity. Okay. Now we'll talk about genetics. Okay. Serotonin's role in gut motility and sensation. Serotonin transporter gene, which is 5-HTT-LPR. As we saw in the previous slide, serotonin is a very important hormone for gut, absorption of food in the gut. Higher serotonin, higher the absorption, so diarrhea. So this serotonin transporter gene, 5-HTT-LPR, shows a positive association between the transporter and genotypes. This increases IBS risk and symptom severity, particularly in specific ethnic groups and for subtypes with IBS or with constipation, which is IBSC. We'll discuss the types of IBS in the next slides. So yeah, serotonin plays a very important role in gut motility. So hence the transporter gene is very important factor which causes IBS. Next we have genes regulating voltage gated ion channels like SC and 5A. These voltage gated ion channels control sodium movement, calcium movement, chlorine movement. These control the absorption of food, water, which has a great effect in causing diarrhea and constipation. Higher the water in the gut, it reduces constipation, but too much water can cause faster movement of food in the gut and can cause diarrhea. But lesser water, which is more absorption of water in the gut, can cause constipation, which are like symptoms of IBS. The gene provides instructions for building this alpha subunit of voltage gated sodium channels, as we learned in physiology. Then we have PI-IBS, which is post-infectious IBS. Variations in genes involved in the immune response and gut barrier function may predispose individuals to developing the condition. So, when you have post-infectious IBS, when you have an infection, it causes inflammation in the large intestine. When you have inflammation in large intestine, after a while the inflammation slightly decreases, but since the person is suffering with IBS, even the small inflammation can cause a greater deal, and this is called visceral hypersensitivity. So post-infectious IBS is based on immune response. Immune response causes inflammation and thus IBS. It also affects the gut barrier function, uh, which predisposes the individuals because gut barrier function is important for absorption and preventing all the change in microbiota levels. So the effect of PIBS and medications is similar. When you take medications for infection, the you know uh, microbiota levels changes because of antibiotics or medications, and this causes IBS again. So these are few of the genes which affect IBS. The first one is TNFS F15, which regulates inflammatory response. When we see in post-infectious IBS, inflammation causes visceral hypersensitivity, a symptom of IBS, and this is one of the genes which controls the inflammatory response. Then we have KLB, which regulates bile acid synthesis in the liver, which helps in food digestion and gut motility. Then we have HTR3E. This is a receptor for serotonin in the gut and CNS. Receptor of CNS, serotonin. Serotonin is very important for absorption in the gut. Then we have TLR9, gut micro mediated activation of immune system. As we discussed in the previous slide, at the last point, immune system plays a very important role in fighting off infections, and this causes IBS. Then at the last, we have SCN5A, produces interstitial cells of Cajal that regulate smooth muscle contraction in the gut. Smooth muscle contraction is basically the movement of food in the gut, and the faster the movement, the smoother the movement, the better absorption and better digestion in the gut. So I also told that gut bacteria affects IBS. Dysbiosis. Dysbiosis is basically the change in microbiota levels in the gut. We all know there are a few bacteria in the gut, helpful bacteria or bad bacteria, whatever it is. Bad bacteria cause infections, but good bacteria like lactobacillus helps in digestion, like better digestion. Secreting enzymes in the gut, and these changes in these levels can cause bad bacteria to occupy more space in gut, which can cause severe infection or stress, and this imbalance can lead to increased inflammation, altered gut motility, and changes in the gut brain axis. This contributes various symptoms of IBS. uh, IBS reduced beneficial bacteria number. Okay, bifidobacterium and lactobacillus are few of the good bacteria which are present in the gut. These secrete enzymes which will be helpful for digestion and absorption of food. So when these are reduced, the bad bacteria levels are increased in the gut, which causes IBS. This also affects enteric nervous system, which controls digestion. Uh, Enteric nervous system basically is a connection between the gut and the brain, which controls the digestion. And when this ENS is affected, it affects motility, sensation, and mood. It's like a wide variety of changes when ENS is affected. Then there are few beneficial bacteria which produce SCFAs. These are short chain fatty acids which help a lot in the digestion. Certain gut bacteria ferment carbohydrates which can lead to gas production and bloating. This happens when the bad bacteria increases. When you take high fiber amount, these gut bacteria have to ferment those carbohydrates to digest. So this can cause gas production and bloating. So it's usually suggested to take low FODMAP diet. Okay. This is a brief explanation of normal microbiota and in IBS patients. In normal microbiota, all the healthy bacteria are there in the gut, but in IBS patients, helpful bacteria like lactobacillus, bifidobacterium, and enterobacteria are reduced. Okay. Now we'll discuss about other factors, which include stress and mental health issues, severe gastrointestinal infections, disrupted gut-brain interaction, and medications. Like I told, stress and mental health issue affects a lot in IBS because stress and mental health issue brings about changes in hormonal levels. uh, as we learned in previous slides, estrogen, progesterone, serotonin, and even testosterone to a certain extent affects gut motility, absorption in the gut. So this causes IBS. Cause if these hormone levels are changed, it causes bloating, pain, and gas in the gut. Then, as I told, severe gastrointestinal infections can cause IBS, like in PIIBS. Infections change, microbiota levels and environment. This affects the digestion and the gut motility, and this further causes IBS. Disrupted gut-brain interaction, like we discussed in the previous slide. If ENS is disrupted, secretions, mood, even the motility is affected. So this causes IBS. Medications also, it is very similar to PIIBS. PI after infection, there is changes in microbiota level. In the same way, when you take medication for an infection, that kills a few healthy bacteria or the good bacteria present in the gut. When these healthy or good bacteria's level decreases, there is ineffective uh, gut motility and absorption or digestion. So medications also sometimes affect IBS in some patients. So now we'll talk about environmental factors. The first one is air pollution. Air pollution can affect IBS by triggering systemic inflammation and oxidative stress, which can alter the gut microbiome and increase the risk of developing IBS symptoms. Air pollution has means there are unwanted gas molecules in the air which will affect our microbiome, like the microbiota levels in our body. When this air pollution increases, it affects the microbiota levels in our gut, which again affects the digestion. Then we have pesticides, which can alter the composition of bacteria in the gut, which can lead to an imbalance, which is called dysbiosis. Then we have microbial pollution. Microbial pollution is increased bad bacteria in the environment. When you are exposed to these bacteria, the gut bacteria levels are changed. Again, the same factor. When the bacteria levels changes, the digestion, motility, and absorption are not completely affected. Then, as I told, stress also affects because hormonal changes are brought about by stress, and these hormones play a very important role in absorption, digestion. Then we have exposure to pets. Some people are, allergic to pets, so this increases immune cell response, and this might change immune cell response in the gut also, causing inflammation and visceral hypersensitivity, which is a symptom of IBS. Then we can also consider prematurity as a factor for IBS because through an immature and vulnerable gastrointestinal system, including a weak gut lining and poor motility, and an altered gut microbiome is seen in children with which are who are born prematurely. So now we'll see about pathogenesis. There are four important points for pathogenesis. The first one is increased colonic motor potentials. In IBS, sodium dietary absorption is blocked, which is a very important, potential gradients channels which control absorption, digestion, and all. And even in a kind, it affects the gut motility, the passage of food through the gut. It decreases intestinal permeability and decreases visceral hypersensitivity. Okay. The next point is central activation of cingulate cortex. IBS patients show more consistent activation in areas which are associated with emotional arousal, such as the preguinal anterior cingulate cortex. These cingulate cortex control the emotional, arousal of a person, which might affect the hormonal changes. And these hormonal changes again are very important for absorption. Then we have serotonin containing enterochromaffin cells. These when these enterochromaffin cells are increased in the gut, this increases the secretion of serotonin. And serotonin, as we know, plays a very crucial role in ENS. And when these cells increases, serotonin increases, and hence absorption. This causes IBSD because increased serotonin, faster passage of food through the gut. So hence IBSD. Then the last one is vanilloid channels, which are TRPV1 or TRPV4. Uh, TRPV is transient receptor potential vanilloid. These are located in the gut and play a very important role in the gut function. These regulate motility, secretion, and nutrient absorption in the gut. So this is a brief mechanism of how pathogenesis works in IBS. So these are the immune cells, the mast cell, and these are the bacterial antigens, which is basically a change in microbiota, which is called dysbiosis. Then this mast cell increases inflammation and decrease in pain threshold. And this hormone serotonin and then these components like histamine and proteases also affect a lot in IBS. So these mechanisms increase permeability, inflammation, and even cytokine release. But in normal patients, normal humans, there is no mast cell attacking, getting triggered by the bacterial antigens or anything. Now we have clinical presentation. So basically, Rome gave us the definition of the syndrome, or how exactly we present this irritable bowel syndrome. Um, okay, so they have given many criteria for presenting the IBS 1, 2, 3, 4, but the most latest and the advanced one is Rome 4. Uh, IBS also presents with mucus discharge and bloating, but the important symptoms are Rome 4 criteria, which includes recurrent abdominal pain. This abdominal pain is for 3 months, and the abdominal pain episode should be compulsorily per week. That means one episode of abdominal pain per week continuously for 3 months. Then another Rome 4 criteria is pain-related defecation. In IBS patients, there is pain during defecation because of which shows the next presentation, the frequency of bowel movements. They go like two or three or more than three times to for bowel movements. That this is an IBSD, but if they have IBSC, they don't go for defecation for like 3 or 4 days. Then the last criteria for Rome 4 is form appearance of stool, which the change in color, the change in texture, the change in the composition of the fecus, the changes in IBS patient. Yeah, and I can also say that IBS is most commonly associated with fibromyalgia, which is oversensitive to pain in CNS. It is also associated with CFS, chronic fatigue syndrome, which is also called myalgic encephalomyelitis. Then we'll talk about treatment. Um, okay, the as I said, treatment. It is not complete disorder treatment. It is mainly by lifestyle adjustment, or if medications has to be given, it is for the specific symptoms a person is suffering from. So when I say lifestyle adjustments, it shows regular exercise, controlling your stress, anxiety, and depression. Regular exercise and controlling these stress levels, because this affects hormonal levels. And as we know, these changes in hormonal sex hormone levels causes plays a very important role in gut motility and digestion. Next is diet modifications. Like I told, you should avoid foods which are not very suitable for your gut environment. Then avoid dairy products for if you have lactose intolerance. Then the most important one is to have low FODMAP diet. Low FODMAP diet is basically decreasing the short chain fiber intake, so that we don't give so much work for large intestine, which causes pain, gas, and bloating. Then the next is medications. We'll be discussing about medications in detail in the next slides. Mental health problems, yeah, like I told, stress, anxiety, depression has to be controlled to control proper functioning of ENS, proper secretion of serotonin, proper secretion of hormone levels. Okay. So next is medications. Antispasmodics, they're believed to relieve abdominal cramps and pains. Basically, antispasmodics relax smooth muscles by blocking calcium influx. Calcium influx are on the channel is a channel transporter on the cells, which controls the muscle contraction. Then we have laxatives, which are for IBSC, irritable bowel syndrome, constipation. Examples are magnesium hydroxide and polyethylene ethylene glycol. Laxatives basically increase water content and soften stools by activating the chloride channel activators. These chloride channel activators are very important for absorbing water into the body, or how much amount of water should be left back in the gut. If we take laxatives, more water is left out in the gut, which softens the stools, which is very helpful for constipation. Then we have loperamide and bile acid binder for IBSD. This slows down bowel movements. Allosterone is a type of loperamide or bile acid binder which is not commonly suggested because it has many side effects, and some of the most common side effect is constipation. When we talk about serious side effects, it includes ischemic colitis, which is reduced blood flow into the intestine, and also bowel obstruction. So this is suggested only in females who have severe cases of IBS. Then we have rifaximin, like antibiotics for short course against bad bacteria. So antibiotics, like I said, medications are not like change the microbiota levels, causing dysbiosis. So when you have high infection, antibiotics have to be given. So it is given for a short course, so that there is not high level of change in microbiota level. Then we have low-dose antidepressants, which regulates gut nervous system for pain and diarrhea symptoms. Antidepressants basically control the stress levels, that is serotonin and hormonal levels. Serotonin, as we discussed, it plays a very important role in controlling, regulating ENS. Hence, it controls the gut nervous system, and it also reduces it increases the absorption and reduces inflammation. Then the last medication is tenofovir, which basically works by blocking the sodium absorption, which allows more water to be retained in the intestines, which is against constipation. So this is a diagram depicting the mechanism of different medications. Here is tenapanor. We have linaclotide. These all control basically the channels in the cells, or in the gut cells, which controls the water retention in the gut. Then we have different prevention methods for IBS. The first one is identify and avoid trigger foods. Like I said, everyone can't eat all types of foods because some can be harmful or can cause infection or inflammation in the gut. So they have to identify which type of food is not good for their gut and stop consuming it. Then we have increased fiber gradually. We can't suddenly increase fiber because, as we discussed, high FODMAP or high fiber intake gives a lot of work to large intestine, and a lot of work to large intestine basically causes bloating and pain because of more fermentation in there. Then we have eat mindfully because as we know, a lot of absorption and digestion or breaking down of the food happens in the mouth by salivary amylase. So eating properly and giving a proper time for digestion is very important because it is mainly a digestion disorder, IBS. Then we have to stay hydrated, like we discussed in the previous slides. It is some of the like many of the medications basically work on water retention in the gut, helping constipation or the amount of water absorption, and controlling the gut motility against diarrhea. So we have to be hydrated at the right amount. Then we have to show some lifestyle adjustments because stress and anxiety will affect serotonin and hormonal changes, so it has to be controlled as we discussed in the previous slides. Then when we talk about recent advancements in IBS, uh, scientists have done a lot of research and got a lot of conclusions. They Some of the recent advancement is microbiota metabolites are substantial contributors to pathophysiology of IBS. As we discussed, microbiota levels are playing like very important role in causing IBS and pathophysiology of IBS. When these levels changes, it affects digestion in a greater way than we expect. So this will cause IBS by changing gut motility and absorption. Then they also find diagnostic tools and biomarkers development because until Rome criteria had come, it was there was no specific diagnostic tool to identify IBS. So they are trying to find more diagnostic tools and biomarkers which will particularly show IBS in patients. Then we have GLP-1 receptor against lower pain intensity. Example is Rose 010. Lower pain intensity is basically related to the visceral hypersensitivity. IBS patients, suffer from a lot of abdominal pain, so this has to be controlled, which is a very painful symptom for IBS. Then gut bacteria producing serotonin reduction. So as we saw, increase in serotonin causes a lot of absorption and faster, passage of food through gut. This causes IBSD. So they are trying to find gut bacteria which uh, produces serotonin has to be reduced in the microbiota. Then we'll discuss about the ongoing research and the future advancements which can expect. So the exact pathophysiology of IBS is very unclear because it has a lot of factors affecting it. Scientists are still doing research on how gut-brain axis is affected in IBS and how ENS is affected in the IBS. Then they're also trying to find precise biomarkers. The biomarkers they have right now are indicating the symptoms of IBS, but they do not show this like direct IBS syndrome. Then they're also trying to find a correlation between microbiome causation and IBS because as we know there are when the dysbiosis is occurring, there are changes in absorption levels, but they also have to know how, I mean, why these microbiome levels has such great impact, and how these microbiome levels causes changes in hormonal levels also. Then elevation of INSL5 only in IBS patients. These are like few of the important research which are going on right now. Mechanism of visceral hypersensitivity and genetic factors. So the last one we had to summarize IBS. This is a slide showing a brief comparison between a normal person and a patient suffering from IBS. A normal person has a stable mental status. He does not suffer from stress, anxiety, and depression, unlike IBS patient. Then normal person has functional microbiota and right level of microbiota in his gut. But in IBS patient is dysfunctional, or there are huge changes in microbiota levels. Then there is intact gastrointestinal lining, which helps in absorption and digestion. But in IBS patients, there is increased permeability in the gut. Uh, we can also see immune activation in the IBS patients. In normal humans, we can see controlled inflammation, and the pain threshold is at the normal levels. But in IBS patients, we can see visible hypersensitivity, which is reduced pain threshold. Then in normal humans, gastrointestinal comfort is there. There is no such thing as abdominal pain or abdominal cramps post-infection. But in IBS patients, we can see abdominal pain, bloating, altered motility of food in the gut. And it in IBS patients, the bowel movements varies in a greater way. So this is all. Thank you.
Thank you, Kushal, for your presentation. It was a wonderful one. Now, I would like Ashwini ma'am to tell her views on this topic.
Kushal, it was really a wonderful presentation.
Thank you, ma'am.
Excellent, excellent presentation. You have done a lot of research and piling up. I liked your slides a lot. It was a very good presentation.
Thank you, ma'am.
Yes, irritable bowel syndrome definitely is. This is the point where our lifestyle, how my grandmother's grandmother used to stay. Probably you should ask your grandmother how her grandmother used to cook and what, when she was younger, how they used to eat. That makes a lot more sense to us because our genetic imprint will be there in the gut. We are designed for a certain pattern, so we are just forgetting the pattern and we are eating whatever we get. We are not supposed to eat. Even if you see the cows on the way, they don't eat everything they get. They are very choosy of what they eat. Everything cannot be digested. Okay, only the goats can digest everything. That's what they say. Okay. So okay, right. And one thing I wanted to say is, they you said mast cells to increase in the gut, but when we see biopsies, no, we don't see much of mast cells. There'll be some non-specific changes that we generally see. The height of the villus will come down, and some inflammatory cells will be there, but they don't qualify themselves to call it, to come into the marsh criteria for us. We have the number of lymphocytes that we have to see in the epithelial cells to determine as a grade 1, grade 2, grade 3 inflammation and all. So they don't qualify. So there'll be very non-specific changes. But to give a report, even the clinician is irritated and we are also irritated. When we say non-specific colitis, no, non-specific enteritis, they'll be like, you don't know how to give the report and that's why you give this kind of report. Because there is nothing coming out of that report. Even patient is irritated. So this is all about the irritable bowel syndrome. Nobody knows what's happening, and everybody is talking only because even in the endoscopy they don't find much non-specific changes. They don't pinpoint everything. So they take up multiple biopsies from every possible area and send it to us. And we are also seeing non-specific changes. They don't fit into any of our criteria. And so we are giving, okay, non-specific chronic inflammation is there. A patient is continuing to having symptoms. Yes, it is a very, very irritating condition, definitely. Lifestyle changes, this is when allopathy or comes to a standstill. We are there only to treat the patient. No, we never spoke about wellness so far. Right from our first year, we have never been taught to about the wellness of a patient. Correct. We only talk about patient. We don't talk about a normal person staying normal. We never speak about it. And suddenly one topic comes up where you say, okay, lifestyle change, you have to change your lifestyle. They have come to you thinking that you will give some medications. And suddenly when we say lifestyle changes, they're like, okay, you don't know anything and that's why you're talking this. So it's a very challenging topic where the patient is also definitely irritated. So that's why irritable. Anybody has any doubts on this topic? Wonderful presentation, Kushal.
Thank you all.
Any questions? One more thing I think they do in the treatment is there is something called normal microbiome implant that they also do, where the because when the symptoms are too much in the patient, they get rid of all the bacteria. There's something called hydrotherapy that is given, where the entire colon is washed off, including the good and the bad. It's like they're making them sterile, and they implant the microbiome. Basically, the fecal matter will be taken from a normal, so-called normal person who doesn't have the symptoms, and these will be purified, and that fecal material microbiome will be injected into the gut of the person, wherein the new breed of the gut, because it is there are millions of bacteria. If you see the list, there is a never ending list of organisms which are there. Okay, it's not just bacteria, even viruses are there. Even parasites can sometimes disturb the brain. The anxiety can come even from that. So there are a lot of things that's happening, so intricately related, that is this is one more treatment, as I know, is also included. You have done any research on this? You want to add any points on this?
Nothing much about this specific treatment, ma'am. Like I didn't hear about completely washing out of the microbiota.
No, when we talk about wellness, no, there are you have to merge the uh, the different various treatments. Okay, so this is a very common treatment which they give in the so-called Ayurvedic and naturopathy people follow it, and they try to harvest. But the implant is done as a part of the allopathic program. So when it is completely cleared off, and they try to implant the normal bacteria into the gut of the irritable bowel syndrome, trying to get a new breed of it.
Ma'am, is this considered to be primary treatment or only in the severe cases?
It's in the severe cases. It's because when everything is failed, you try to give a good lifestyle change, everything is changed, but still the patient is continuing to have the symptoms. This is one of the options that's given, where they can be implanted into it. How they do the implant, I'm not very sure. If there's any medical people, medicine person, there was one more moderator along with us.
Ma'am, he couldn't attend because he had duty, ma'am.
Okay. Probably we can ask one of the surgical gastroentero peoples next time to see. But even I was, because this is something which was discussed even in our sessions, that there is an implant that will be done. But how the implant is done, that I was not very sure. Anybody else has any doubts on this matter topic?
If the audience has any doubts, they can either ask through the voice or put it in the chat box. Ma'am, I don't think anyone has any doubts right now.
Okay.
Ma'am, but one doubt from my side is that in modern lifestyle now, especially during our MBBS time, we don't get enough time to maintain a good, healthy life. Like sometimes we have to eat junk outside and all. Especially like during our internals, also we didn't get enough time for lunch break, so we had to like
You know
eat
what?
outside.
Yeah,
And all.
okay. Good
So
question. Actually, good question. No time is even, because even I try to implement it. Even we make comments that I never find time, but we do find time to see Netflix in between. We do find time to gossip in between. We do find time for so many nonsense which is not required in between. And I do by, I am when bored, He said, the gut and the brain are related. When I am bored, I do buy samosas from that Nandini shop and I eat. Then I realize, for instead of buying that samosa, I could have might as well bought bananas or the gavas or whichever fruit is there available just outside our campus for the same price. And I could have eaten. So junk, this is something which we have made ourselves easy. People used to eat fruits in the afternoon when we were kids. No, actually, when we used to go outside to play on Sundays, whatever fruit was available, that whole fruit was the lunch. So much fruits. It's not like one or two fruits. It's like kilos of fruits. We used to sit and keep hogging till our stomach is full. So this is the change that we have brought in. We'll try to sit in one place, scroll through the mobiles, and we complain that we don't have time. It's not that we don't have time. We don't want to make time, probably. Yeah. Traffic is one thing I don't think we can avoid if we are coming from a far off place. But there are so many things that we can still change in between, probably, and learn. Even when we are eating, no, healthy stuffs, eating whatever at least possible idlis, dosas nowadays makes a lot more sense to eat a lot of probiotic, fermented ganjis. They used to, my grandmothers used to prepare a lot of ganjis. Now, somebody who eats ganjis is considered poor. They stopped ganji altogether. So now nobody makes ganjis. I don't think you people ever had ganjis. Because when I was younger, only people who eat ganjis were considered poor. So we stopped eating ganji altogether. Whatever is leftover rice, no, that rice will be squeezed properly in the water and left it till the morning. Next day morning to that, you add a little bit of curd and then you, if required, you add chili if you want spicy, or you add a little bit of salt, squeeze it properly and drink it off. The leftover rice itself ferments and that's ganji. The same Korean food, no, that is very famous. What's that called? Our ganji is called something there. Ki. And now in India, it is back that you eat that Korean food, and that's good for health. I said it's the same Indian food which we used to call ganji. That same thing. So there's some modified, but it sounds the same. That's what I said. Ask your grandmother what her grandmother used to prepare. We all have a DNA imprint that is there. It comes in the memories. No, IBS will not cause cancer. Definitely no. IBD, on the other hand, can cause cancers because there is a long term inflammation which is there. Irritable bowel syndrome, I'm not seeing much of changes in the gut. So it will not cause cancer.
Thank you, ma'am, for your answer. So, if the
Uh,
audience has any other,
yeah,
yes.
yeah. I want to add one thing, ma'am. Actually, I started doing one research in IBS,
Hmm.
and to continue the research, one problem was there. Actually, we were not able to get a diagnostic criteria as such,
Correct.
because even though we say this, the clinical criteria, the Rome 4 criteria, which we discussed, that is a very like vague criteria, and you also mentioned that the histological findings are also non-specific. So, ma'am, can we say that IBS is a diagnosis of exclusion?
Definitely, you have to exclude all the notable causes. I have to rule out all the irritable bowel syndrome, or I have to, sorry, not irritable, inflammatory bowel disease, or I'll have to rule out all the malabsorption causes. Then only we report them as irritable bowel syndrome. Histological features, they will give us biopsy. And the moment we say nothing I'm seeing on the biopsy, then only the patient will be treated as irritable bowel syndrome. But they do send us biopsies.
But ma'am, even the biopsies won't be taken that frequently, na? Like, is it an indication for like IBS?
That depends on the clinicians. If the clinicians, many a times they do come with chronic diarrhea, bloating sensations, and they do scopies. And if they find any areas which is patchy, more reddened, inflamed areas from the duodenum, it's not just from the colon, even from the duodenum, we do get biopsies. We do some non-specific changes in the stomach, in the duodenum as well. Biopsies will not be taken from the jejunum. Both scopies will be done, upper and lower GI scopies.
Okay, okay, ma'am. Thank you, ma'am.
So if the audience, anyone has any doubt, you can ask through the chat box or you can raise your hand. Uh, so from this, I feel there are no more doubts. So once again, thank you, ma'am, for attending this session and adding your knowledge to it. Also, thank you, Kushal, for your wonderful presentation. And also, at last, thank you for the audience for attending this session. Thank you, everyone.
Thanks a lot. Thanks, Kushal.
Thank
Thank
you.
you, the Science Club, for making me a moderator on this. I enjoyed the session. Thanks a lot.